Good morning, all. I'm Yasmin, Field Marketing Manager for the public sector at Salesforce, and today I am very excited to introduce Mark Chambers and Jason Towler from the NHS Blood and Transplant today for this webinar to explore their transformation journey with Salesforce. Before we get started and I hand over to them, please feel free to pop any questions you have throughout the webinar into the chat function, and we will answer these at the end of the webinar. Thank you. Over to you.
Thank you. Well, I'll go first and on to the first slide. Thank you, Jason. As Yasmin has said, my name's Mark Chambers. I'm the Director of Donor Experience. Jason?
I'm Jason Towler, Head of Direct Marketing.
So we're going to talk through our work that we've been doing in the last 12, 18 months working with Salesforce. But I want to just give a bit of background into who we are and what we do. So if you can jump to the next slide, please, Jason. For those who don't know NHS Blood and Transplant, we are basically here to collect blood, plasma, platelets, stem cells and organs to save and improve lives of people across England and in the UK in certain products. And our ambition is to improve even more and save even more lives, creating a world where every patient receives the donation they need. And I'll go through to explain what that means, because at this moment in time, we're in a place where we don't have that. Next slide, please. I mean, we're kind of a funny organisation. We are a healthcare biomedical manufacturer and supply chain organisation, which a lot of people don't see. We collect blood and we get it across the country, and we have similar challenges to grocery stores and retailers about moving things around the country to get to the right people at the right time. We are a special health authority and we are part of the national infrastructure of the UK. So when there's an emergency, we are a part of that as an organisation. But we're also an arm's length body, so we are accountable to the Department of Health and Social Care. So any changes that you hear in the news around spending cuts and things like that that come into the Department of Health and Social Care impacts on us. And we are regulated by a number of big organisations there, including the CQC, MHRA and the Human Tissue Authority. Our headcount is around 6,500 people, and we have a budget of around £625 million per year, which doesn't go as far as we'd like. Next slide, please, Jason. And this slide just shows where we are and what we do. As you see, we've got various operations across the country, not much in Wales, but across the whole of the UK, including Scotland and Northern Ireland. And these slides will be shared, so you'll see some of this information around what we do and where we do it. But our main operation is in England, where we collect blood and plasma. Next slide, please. One of the challenges that we have is that we need to actually, Jason, can you skip to the next slide and come back to this one first? Yeah, so more broadly, our strategy is, these are our 5 headlines. And the work that Jason's going to talk about really covers those first 2 strategy points, which is to grow and diversify our donor base to meet clinical demand and reduce health inequalities. Now, for those that don't know what health inequalities is, it's ensuring that everybody, irrespective of race, background, culture, gets the healthcare that is needed for them. But a big challenge for us is around how we grow and diversify our donor base, which I'll come on to in the next slide shortly. And then the second one there that Jason's involved with this presentation is how we modernise our operations to improve safety, resilience and efficiency. Our operations are behind the times. We do have some tech debt within the business because we have real challenges, and some of our systems are 25 years old and cause some real challenges. So this work that we've done here with the marketing automation tool has been really key in driving our operations and ensuring that we engage with donors in a better way. Other parts of our strategy include collaborating with partners, driving innovation and investing in our people and culture. But as a member of the executive team, I'm responsible for growing and diversifying our donor base. Can you go back to the slide, Jason? Sorry. So within that, in terms of growing and diversifying our donor base, we know we need a real diverse and active donor base. And Jason will come on to talk about that a little bit later. But for those that don't know, in our blood space, we only have, and I say only have, 800,000 people who actively donate blood, plasma and platelets each year, which is less than 2% of the adults in England, which is a real challenge. People think there's more. So we need to really drive growth in that area. We also need to drive growth in our organs area, which if you see underneath there, we have 30 million people on our organ donation register. It's not enough. I'll come on to talk briefly about that. And it's not enough because there's a real feeling that everybody feels they've been opted in with the law change that happened a few years ago. They haven't. People have to go in and still confirm their decision to say that they want to give their organs. And my challenge to everybody who I speak to about organs is if you'd accept an organ, then you should be willing to give an organ. But only 1% of deaths in the UK are happening the way where organs can be given. That's a tiny, tiny amount. So it's a real challenge to ensure we get enough people on the register, and to ensure people can get the right donation, we need more people on the organ donation register. Can you skip forward a couple of slides, please? There we go. So to talk about blood briefly, which I know Jason's going to talk about within his section, mainly, we have over 235 mobile sessions per week, and we have a volume of fixed donor centres in town and city centres, which open at various hours, but include evenings and weekends to try and support the lives of our donors. We have around 50,000 appointments every week, 50,000 appointments, but we only collect from around 35,000 appointments every week because of cancellations, because of donors not turning up, because of deferrals on session where there may be problems with donors and things like that. So we collect less than that. And what a lot of people don't realise is that blood only has a shelf life of 35 days in the UK. So that's a real challenge. That's why we need to collect blood every day to ensure that we have the stocks required to meet patient demand. And the big challenge that we have there is around the diversity of the donor base. And it's more around genetics, because one of the big areas that we have challenges on is with sickle cell and thalassemia patients. And we don't have enough blood that meets their genotypes, their genetics, to ensure they get the right blood to help them live healthy lives. So there's a lot of work we need to do in engaging Black heritage donors who have the right genetic makeup to support these patients. Next slide, please. One of our growth areas is plasma. So with every blood donation that we collect now, we collect plasma. And you'll see that it makes up 55% of our blood. And what a lot of people don't know is that plasma that's already collected within your blood in every blood donation, we use that to also make medicines now. And we've also started to collect plasma directly. We've got an operation which is very small. We've got 3 sites in the UK, which is in Twickenham, Birmingham and Reading, where we are collecting plasma directly from donors. And you'll see that we have started to make medicines, life-saving medicines for patients in the UK, which is really, really important now. Next slide, please, Jason, which is on organs. The only line I wanted to pull out on here is that every day across the UK, someone dies waiting for an organ transplant. Every day, which is a real challenge. More than 7,000 people on the active transplant list are waiting for an organ, including more than 200 children. So we need more and more people to sign up to the organ donation register. But that's not the premise of this conversation. What Jason's going to focus on is more around blood. And just to say, we are adapting some of our work to include organs now, but blood has been the hero product that we've started with. So with that, I'll hand over to you, Jason.
Thanks, Mark. So yeah, I'd like to talk to you for a little while about where we are on our journey with Salesforce Marketing Cloud. We're not at the end of that journey. It's really key to sort of keep that in mind as we're going through here. We brought the tool into the business around 12 months ago, and we've seen some really great benefits from having it. But a lot of the stuff that we're going to be talking about is, things that we're working towards. So why are we doing this at all? Well, as Mark says, there's a bit of tech debt in the business. So at the moment, in order to fill those 50,000 appointments every week in our whole blood donation program, and also in the plasma and platelet donation program, we have a fairly complex and possibly overwhelming sometimes suite of communications that are sent out by email, phone call. We still have some physical post. We send a lot of SMS messages, and we do some push messaging through our app. but there's no central coordinating system triggering all of those comms. We use a combination of our own proprietary core database system and Microsoft Access, and it's an old version of Microsoft Access as well. So these things are all doing logical selections. They're finding blood donors without appointments who live in areas where there's opportunity to donate and sending comms to them, but they don't necessarily know when they're making that decision that that donor might have been contacted the day before by a different channel, so you don't get that consistency of messaging. We've also got a range of different visual styles that have evolved over years. So really what this operation's about is bringing all of our systems, our decision making together into a single unified platform, redesigning all of our work so that we have a consistent look and feel right through that journey, and then starting to generate that data about donors, so understanding what we've sent to who and what they've then done as a result of that, so that in the future we can do really genuinely data-driven decision making. So the business was clear that it wanted to do this. We sat down with our commercial colleagues, we wrote a business case, we wrote a set of requirements and tested them against the market. And every supplier who came back saying that they'd like to work with us recommended Salesforce Marketing Cloud SFMC as being the tool that they thought best met our requirements, which made it a bit of a no-brainer as to the route that we were going to go down. Incidentally, as I go through these slides, you might hear me use SFMC and MAT interchangeably. MAT is Marketing Automation Tool. That's just our internal language for what this product is. So if you hear me say MAT, I mean SFMC. It's just the name for the platform. So we went to market. We procured the tool and a delivery partner to help us onboard it. That delivery partner worked with us to do all the configurations, setting up the email domains, environments, and our send accounts. And then they worked with us to replicate 3 of our key marketing interventions that we presently send from, that we previously sent from different systems, just to test that the tool was able to meet all of our requirements. So they were the See Where Your Blood Has Gone email. Now, if any of you have given blood in the last few years, you'll know that after that donation, we like to let you know where that product has been issued. It's hugely popular with donors, and we were really, really keen to make sure that we were able to replicate that functionality in the new tool. As it happens, it does it absolutely brilliantly, but it's really complex communication data-wise. You need to pull in lots of different things to be able to say from lots of different tables to be able to say exactly where a product's been issued. We did our donor newsletter, which is demonstrating the ability to do large, complex, segmented campaign sends. So the newsletter generally carries about 15 different articles, and we have, I think it's 7, maybe 8 core variants, depending on what product you regularly donate, what your ethnicity is, what we'd like you to donate in the future. We'll vary the articles that you see, and SFMC is really, really good for doing that. Just as an aside, we used to have around a 4-week build time from the moment that we got all of that content delivered to us from stakeholders in the business. Earlier this summer, we turned one of those newsletters around in 3 days because of the templates that were set up in the tool. So just a real huge improvement in our ability to deliver that sort of work. And then the final one, and probably the most interesting for us going forward, we asked them to build a session invitation process. So this replicates a process that we originally had, where it's 2 months, 8 weeks prior to a session starting. So this is one of our mobile sessions, so a church hall or a fire station session where we'll be visiting that particular community location maybe 3 times in a year, maybe 6, which means that the appointments at that session are, they're a limited resource, and we know that donors want them. The response from donors is always superb. So to try and make sure that we get the right bloodstock mix, because to Mark's point, you only get 35 days of shelf life from blood. There's 8 different types and then 1 really critical blood subtype, and we need to make sure that we've got the right balance of all of those groups. So the 8-week process basically looks at all upcoming sessions in 8 weeks, identifies how many available appointments there are at it, and then running down a list of priority orders, we'll select a number of donors to invite to that session. And that's kind of the jumping off point then that we'll be building all of our session invitation communications off of. So they built those 3 campaigns, we tested them, they all worked fine. And then just prior to going live, we undertook a period of IP warming, which is basically where you take a large volume send, split it down into incrementally larger volumes. So on the first day, you send maybe 500. On the second day, 1,000, and then ramp up and up and up until on the final day of, I think it ran over 2 or 3 weeks. On the final day, you're sending tens, if not hundreds of thousands. And this is just to make sure that all of the email service providers are familiar with you, know that you're not a spam farm, and that people enjoy engaging with your content. So that's a really critical thing before we start moving business critical communications over onto the tool. And they also conducted 2 week-long staff training sessions with my team and some of our colleagues from IT at NHSBT, which is DDTS, to make sure that everybody was fully up to speed with using the tool. So since we went live literally yesterday, actually, 12 months ago, it's our birthday with SFMC, we've delivered 65 individual campaigns. So that's over 1 piece of new work every week in that time. Some of that will be appeal work, some of it will be planned campaigns. And that's a total volume of around 15 million emails, and that'll be going up all the time. And we're also starting to send more and more SMS messages through the tool. So we're using it in a really major way, but at the moment we're mostly using it to support campaign activity rather than replacing our business as usual invitation processes. And I'll come to why that is and how we're looking to remedy that shortly. And this is a really good case study for that. So shortly before we went live last year, NHSBT had to declare an amber alert for O group blood stocks. This means that we'd fallen below the level that we're mandated by DHSC to maintain stocks at. It's a very big deal for us. It's something that we consider to be a never event. We work really hard to prevent it from happening, and unfortunately in this instance it did happen. But because we had the new tool in house, we were able to very, very quickly turn around an appeal campaign that we sent out to 85,000 donors without an appointment, explaining where we were and what the situation was, and appealing for them to donate. And the next slide here just shows how SFMC responds and gives you feedback on that activity. So at a click, you can see exactly who the... Can you see my mouse pointer, by the way? You can. Cool. So at a click, it shows exactly how many opens, your standard email metrics, opens, clicks, unsubscribes. And you can watch this in real time, which is something that we never had previously. So this campaign we were able to turn around in 3 days, rather than the 2-week SLA that we had with our previous email supplier. Emails used to actually be built out of house by a third-party supplier. We'd deliver briefs, they'd do the work and send it back to us. And you can see here we got around 7,000 clicks, 6,500 clicks, and we booked well over 1,000 appointments in that first week just off the back of this. It didn't fix the long-term challenge with blood stocks, but it really helped in the short term to help us mitigate the impact of that amber alert. And the next slide just gives a taste of some of the work that we've done. So we have collaborations with Disney, we've been doing partnerships with TV, and this one here is about the end of that amber alert period where we went out to donors to thank them for their support. As I say, we've done 65 individual pieces of work in the 12 months that we've had the tool, all of which we have that fantastic performance data for. But that's just one element of it. Campaign activity is really important to us, but it doesn't deliver that bread and butter day in, day out, 50,000 appointment bookings that really ensure that we're delivering the blood that we need to hospitals. To do that, and to go back to what I said right at the top of the show, we have around 76 Microsoft Access databases, all of which are running on a daily, if not or weekly basis, producing data to drive email campaigns or letter campaigns or send text messages or phone calls. And broadly speaking, they fall out into one of these 4 categories. So we've got appointment reminders, speaking to donors who have booked already to try and ensure that they can attend, and that when they attend, they have the best possible chance of being able to give a successful donation. So as Mark said, just attending doesn't mean you'll necessarily be able to give. Your iron levels in your blood need to be high enough. We have various restrictions around foreign travel, dates from last tattoos and piercings, and then just general questions around donor well-being. So we're really keen to try and give that information to donors off sessions to ensure that when they actually do present at a session to donate, they have the best possible chance of doing so, and we're not wasting their time, and we're also not taking up an appointment slot that could be used by a different donor. We have what we call donation lifecycle comms. So this is everything from your welcome pack, onboarding, the journey we take you through to try and get you from having declared an interest in donating blood to actually being sat on a chair doing it. And then the non-happy path comms. So if you've had a deferral, if your appointment's been cancelled either by yourself or by us, and then right at the end of the donor's time with us. So either they've no longer able to donate for a medical reason, or they've hit our sort of top age threshold. So all of these communications, we then have everything that we send to donors after a donation. So thank you comms, that's see where your blood's been issued, all our donation milestone card packs and that sort of thing. And last but definitely not least is what we call session fill. So these are those invitation comms that drive appointment booking and get people through the door. So we are now looking at each of these four.
I think Jason's Wi-Fi dropped out slightly. Let's give him a couple seconds to come back in. Oh, you're back. You're back now, Jason.
Am I back?
Cool. Yeah, you're back.
Sorry about that, everyone. I did warn Mark that might might happen. So yeah, basically we're looking at each of these four categories of communication, and we are designing new journeys that will then build out in Salesforce Marketing Cloud, and that will then underpin basically everything that we do from a donor communications point of view going forwards. And as luck has it, later today I'm having the go no go decision call for the appointment reminder journey. So this is the first one that we chose to tackle. It's relatively self-contained, but it's got real opportunities for clear benefits to the business around making sure that donors attend the session and that they're in the best possible preparation to be able to donate. Now, the way that we've chosen to do that is using the Journey Builder functionality in SFMC. Apologies if this is a little bit small. The detail's not critical. I think what this helps to do is just give a sense of how you build that out. So each of these nodes is like a decision point that can then lead to a communication being sent. And this is where we really are getting into those personalised comms. So at the moment, if you book an appointment to give blood, we'll send you a reminder about that appointment, but it'll be the same reminder that everybody else gets. We'll take no consideration as to whether it's your first donation or your 100th donation, whether you're a super high value blood group or a less high value blood group. That language is potentially problematic, but we do have, some blood groups that we do need more consistently than others. And the plan is that, yeah, we will start to really personalize those comms so that we're giving donors the information that's most important to them at that point. So you can see here, we have a single moment 5 days prior to a session where we send an email to donors asking them to check their eligibility status and confirming the details of the appointment. Previously, there was just the one. We're now going to have 15 different key content variants using just those bullet pointed attributes. So where they are in the donation journey, whether they're coming to plasma from whole blood, or whether they've been whole blood donors for a long time, or whether they're coming back after a lengthy absence. And then on top of those core content segments, we're going to overlay blood group specific information. So if you're an A-neg platelet donor, you're a really, really important, like high value donor. Similar if you're an O-neg or a B-neg, or what we call an RO blood donor, and we'll be giving particular information about that as part of it. So this is a real kind of step change in the personalization of our comms. We've always been able to acknowledge people's blood groups, but being able to differentiate exactly where they are in the donation journey and deliver targeted messaging to them, it is really going to change the way that this works. The pilot's going to run for up to a month across 10 of our donation sessions, and we're going to be keeping an eye on all of our various business metrics to make sure that what we're seeing is the impact that we want to have. And it's really, really critical to make the point that this is our starter for 10. So making use of the functionality that the tool has, bringing this personalization into communications, but it's not like a fire and forget, turn it off and then walk away. What this does is gives us the platform that we can easily then iterate. We can start matching images to particular donor characteristics, so age, ethnicity, potentially gender. And we can trial and see whether that actually works. There's a lot of theories about whether people like to see imagery that's matched to them personally. And it seems a little bit like there's no clear-cut answer to that, but we will now have the functionality that lets us test that in a really dynamic way and then roll out the winning campaign. So that's where we're at with appointment reminders. As I say, hopefully that pilot's starting today. Very quickly, just on challenges that we've seen through the process. Public sector procurement's always difficult, but it does mean that we ended up with a really, really robust set of requirements. And as a result, we got exactly the tool that we wanted. So going through that initial pain of really laying out what our requirements were, doing a lot of soul searching about what we really needed, what would offer the biggest benefits means that we did end up in a situation where we got the right tool. Skills mix is an interesting one. So as with any tool, you find that some people really instinctively get it and fly, others take a little bit longer. There's also sort of ongoing questions about whether we have the right levels of support and expertise in the business, and whether we need to fundamentally change some of the structure and expectations around roles. And finally, and this is the one that I'm feeling the most keenly at the moment, is the pace of change. So the tool's amazing. It can do so much, and there's so much as a business that we want to do. But we're here a year later, and we're just now rolling out the first of our big business as usual processes. We need to get those other ones done and migrated so that we can really start to reap the benefit, that we can genuinely have that single view of all of our donor comms history, start to build the data up that lets us do big data decision making in the future. I think we'd all rather be slightly further down the road than we are. But as Mark says, we have to collect blood every day. We can't get this wrong and make a change that's going to negatively impact on the business. And similarly, we can't just shut operations down for a week while we sort everything out. It all has to be done in the context of what's happening in the real world, and that does occasionally make it challenging. I think I'm near the end. I've got a quick slide on next steps. So as I say, just finishing the existing BAU donor comms journeys and rolling those out so that SFMC then becomes our sole originator for all of our comms. There's also a big piece about reporting. So what this tool really does is gives us access to mountains of data that we've never had before. What time do people open their emails? How many emails do you need to send them before they'll follow through on an action? That data as it stands sits in tables in the background of the tool. It's there available to us, but we need to get it out of the tool and start to dig into it and understand it. So we have an insight function within Donor Experience who are at the beginning of that process now of getting access to the data. But again, the more comms we re-platform and the more stuff we're sending, the more robust our donor history is, the more that data will start to tell us. So that's a really critical part of the next step, is making sure that we're getting all of that reporting right. And that is me. We'll stop and take questions.
Thank you, Jason. I don't know if Yasmin wants to come in there, but there are a couple of questions in the chat, which either of us can answer, to be honest.
Sure, let me just pull the chat up.
So I can read the first one out if you want. Richard Jenkinson, I don't know if he's still online with us, but Richard has asked, will you plan to tell people why their blood group is special, high value to education through comms? Do you want to answer that, or shall
I? I'll take a run at it, and if you think I miss anything, you're welcome to dive in. But absolutely, that's really part of what we want to do. We already do a little bit of this. So if you're an ONEG donor, chances are that you'll have been familiar with our first responders branding, which is linking ONEG, which is the universal blood group that you can donate to anyone in an emergency, basically. So we have to collect a lot more ONEG than there is in the population as a proportion. And that's worked really well. We collect roughly 14% of blood from ONEG donors compared to around 8 or 9 in the population. That, I think, has given us a clear indication that people do want to understand more about their blood types, and that it's a useful lever to encouraging them to donate. I'll be honest, some blood types have a much stronger narrative and explanation for their value than others do. I'm an O-pos donor. There's a lot of us in the population. Really, the story there is just we need a lot of it because a lot of people are it. But even that is useful to know, I think. So yeah, it's definitely one of the things that we're looking at including in comms. And certainly at that critical first point where a donor's given their first donation, which is when the vast majority of people in the population, other than a medical setting, will actually find out what blood type they are. So that's the moment when we're really planning to try and land that education piece.
Great, nothing to add. I see the second question from Nahidu. We're sharing slides, aren't we, Yasmin?
Yeah, we will be.
Yeah, that's fine.
We've got another question from Matthew Rutter. Are you seeing any improvement in the diversity of donors through this approach?
I don't think we are far enough into this yet to be able to clearly see an improvement in the diversity of donors. A lot of the activity that we're undertaking to improve the diversity of our donor base is around recruitment. So reaching the right communities and getting interest at that registration point, and then making sure that there's opportunity for people to come through and donate. Where I think we may start to see improvements in diversity is when we get into more personalised comms and start to really understand what it is that people want to see and what is compelling for donors. Again, as I said, we've got a lot of theories about seeing ethnically or gender matched imagery on comms, but we don't actually know for certain like which approach is right. But this gives us the platform to be able to learn that and then rapidly roll those sorts of learnings out across comms. I don't know if you have anything to add there, Mark.
The only thing I'd add there is that we also know that to get more diverse people to donate, it's not just a case of sending an email. We do have a big community engagement arm that has to talk to people, and we have the community grants program, which talks directly to donors to help us drive bums on seats because of the lack of trust that we are seeing from diverse audiences with not NHSBT on its own, but in the NHS more broadly. So we are able to track some improvements, but we can't necessarily drive that directly to this tool specifically. But as Jason said, we might be able to do A/B testing or things like that as we move forward with some of the things we roll out with certain community groups.
Great. We've got another question from Gareth Ricketts. He's asked, how are you looking to get a higher donation rate from poorly represented ethnic groups?
Want me to answer that one? Yeah, I'll take that one.
Yeah.
Yeah, so kind of what I've just said, and I don't think Gareth's on the call, but hopefully he watches the recording. It's not just a case of using the tool on its own, it's how we work more broadly with our community engagement teams and our community grants program, where we've got organisations that work in the community on our behalf, talking directly to donors, potential donors, into people who can be ambassadors for us, who can talk and encourage people to donate and talk about the benefit of this. The challenge we have is making sure we have the right appointments in the right place at the right time for the right people. So recently we opened a new donation site in the heart of Brixton. And that is our second most diverse collection site within the country, and it's only been up and running for 9 months, behind Stratford, which has got the most diverse group. But what Brixton also has is the youngest group of donors that we've of any donor centre that we've got in the country, because it is really attracting the right donors to the right place and opening at the right times. So there's things like that we're looking to do, as well as we've just kicked off our group bookings activity, where we are specifically working with Black heritage communities to get them to come in and donate together at certain times of the day, where we are encouraging some of our community groups, community partnerships, to go out and engage with some of these communities to get people to come together and have certain sessions. So we might block out 30 sessions, 30 appointments on a session that are for certain community groups to come together and donate and things like that. So there's lots of activity we're doing in this space, but it's not just the MAT tool on its own.
Great. And there is a follow-up question from Gareth off the back of what you've just discussed. So are you looking to engage via the Department for Education to be able to improve awareness in the younger demographic?
Yeah. It's a straightforward answer. We do already have some activity with the Department for Education. You will, if you watch the news later today, if you're in and around London, we have just launched a new book targeted at Black heritage, to talk about the need for more Black heritage donors to come and donate, which is going out later today, and that's in partnership going out to schools in and around London, and we're hoping that we can push that a little bit more and get some support to try and fund some more of those books to get them out more across the education system across the country. So yes, we are working with the Department for Education.
Thanks, Mark. We've got another question from Robert Humphreys. He says, there's a lot of paper admin in the process on a donor session. How much do you think you can digitize, such as the online survey that can screen donors before attending?
Shall I take that, Jason?
Probably. I mean, I could add to what we'll do from a marketing perspective to support it, but yeah, I'll let you take a first whack.
Yeah, it's work we're doing right now. We have a large program which is looking to take more paper off the session and pre-screen people, so that we can get more people through the door and more people make a successful donation. So it's a big program activity that we've got, which hopefully should kick off next year. It should be live from next year. So we're piloting it now. We know it's an area that is really tripping us up So it's not just a case of us doing our work to get donors through the door, it's across the whole system as well. Where can we make improvements across the system? So that's one area we're looking at, as well as post-donation testing. So instead of doing all the tests that we now do at the start, we are looking to maybe do testing more clinically and medically within our labs of the blood that comes through, rather than turning donors away on the day. So yeah, we're doing lots of things to try and fix that.
Yeah, I guess all I would add to that is that once we've got that off-session screening system really nailed down and kind of ready to work as a replacement for the paper, it will then become a critical part of the appointment reminder comms process. So we'll be asking donors to effectively, similar to checking in for a flight, to check in prior to a donation, do that screening at home off session, and then follow the data through. So yeah, it'll inevitably change the shape and the way that we deliver a lot of this information in advance.
Great. Richard Jenkinson's asking whether you're using Salesforce Marketing Cloud to target also by geography, for example, specific focus and comms for people who live close to the 27 permanent centres.
Yes. So in our campaign activity, we often do focus on those particular locations. Similarly, to try and support the ethnic targeting that we're doing, there's work done looking at parts of the country where there are, particular conurbations of the communities that we're looking to engage with. From a session fill perspective, that's entirely driven by geography. So without getting too far into how the sausage is made, every session has a panel of donors who are sort of loosely affiliated to it, so at least live or donate in the area, and they'll be our core target audience for fulfilling that particular session. And interestingly, looking to break that direct link is something that we've long considered, because just because you donated at one place previously doesn't mean that that's the only place you ever will donate. Doesn't mean it's the only place you'd consider. And we do know that obviously the town centre and city centre donor centres, they behave in a very different way to the mobile community sessions that we run. They're there 5, 6, 7 days a week in some cases, offering appointments from morning till evening. That's a lot more capacity for us to try and fill, but it's also a lot more opportunity for the donor to find something that's convenient for them. So it's less pertinent to sort of tell them 8 weeks before that session, we want you to come and donate at the West End Donor Centre in London, because they could donate there tomorrow if they're eligible, or they could book an appointment for 4 months down the line. So there's a fundamentally different strategy needed for filling the two kinds of programme, and geography is a really key part of that. Yeah.
We've got a follow-up question from Richard on that. So do you have geodata on where people work?
We don't directly capture where people work, no. We can infer some of that from behaviour, but we're not doing that in a way that's kind of systemised and that we're able to use to make marketing decisions at the moment. There's a field in Pulse for it, interestingly, Mark, without, again, getting wildly off track. But yeah, it's not data that we routinely collect. Obviously, if you commuted into London, say from Kent, and you routinely donated at the West End Donor Centre on your lunch break or something, you would be invited to the West End Donor Centre location rather than probably the session nearest to your home in Canterbury, say, purely because of that panel system. So we can infer, and we don't always just invite people to their home addresses. We'll tend to invite you to where you're donating.
Great.
Just to add to that as well, more broadly than Matt, we do. I think if I take your question more broadly, engaging with people where the work is really, really important. So as part of our strategy, we do engage with businesses local to donation sites and donation centres and some big employers. One of the things we kicked off this time last year was donate breaks, where we're encouraging businesses to encourage people to donate in the daytime whilst at work. So like we all do, we go to the dentist at certain times of the day, or we have doctor's appointments or hospital appointments. This is in the same category as that. So encouraging business owners and leaders to really enable their staff to go and make donations at local sites, because our donor centres have lots of appointments in the afternoons available to lots of people that don't get filled at this moment in time, following some of the changes that we all have in our lifestyle after COVID. So that's one of the things we're really pushing, and we've got big organisations like TUI, ITV, I think one of the banks is signed up, might be NatWest, Vodafone, etc., etc. So if there's something like that you want to get involved with, do let us know. But we are pushing to encourage more to do the same, because actually we are. Oh, that's your dog. We are part of the national infrastructure, and we are part of the NHS, and it's really, really vital that there is a real assumption across society that blood will be there all the time, and it's not there unless people are donating.
Thanks, Mark. We've got another question from Matthew. Are you looking to add to the channels for comms with your donor base, including app notifications, for example?
Yeah, so push notification is something that SFMC delivers natively. It's a piece of functionality within the tool. I just required a small tweak to the API connecting into our app to deliver it. So we do use push notification. And there is a potential model for the future comms journey that goes strongly digital first. If you're going to be completing your pre-donation screening check on a mobile device, or a tablet or a phone at home, then why would we not try and manage that donation entirely through that device as best we can? So certainly push notification. At the moment, it's a relatively small part of our channel mix. We do deploy it for some kind of blood-specific appointment appeals, and we do some last-minute session fill activity via it. The challenge that you get with notifications is that people can quite easily opt out of them, and that you don't necessarily see that information reported back in your systems. It lives on the handsets. Obviously, if you're doing large-scale digital marketing, you don't really want people opting out as much as possible, and you want to give yourself the best chance of reaching your audience. But certainly, it's going to be a critical part of any comms mix going forward, and I think it will only increase in its importance.
Thanks, Jason. We've got another question from Nahida. Would having a digital version of the blood donation screening form that patients fill out be useful to the NHS Blood and Transplant? Having a digital form sent to your phone before your appointment to save time, ease of use, and having to deal with a paper form.
Yeah, I think we've covered that.
Yeah, we're doing that now. Yeah, we are
Yeah.
doing that now. Yeah.
Any more questions in the chat for Mark and Jason? I think we've covered all the questions.
Lovely. Well, thank you all for having us. It's been a pleasure speaking with you this morning.
Yeah, thank you.
Mark.
It's been great.
Thank you, Jason. And thank you all for joining.
Thank you all. Take care.